Hector's mother enrolled him in Legacy's school-based healthcare program at the beginning of the school year. The nurse noticed that Hector's asthma was always worse on Monday. He struggled with schoolwork. He only watched while others played. The pattern was consistent. The nurse gave him his medication during the week, but every Monday, his asthma flared up again. Because she cared, she went beyond the clinic walls to identify the problem. She learned that money was tight. There was no insurance and no medication for Hector during the weekend. So when he returned to school on Mondays, his asthma was terrible. Understanding the family's situation, Legacy ensured that Hector had what he needed at all times to maintain his treatment. Now, there are no bad Mondays. Hector is just one of the kids. Life was good. Richard had everything going his way. He was happy, healthy, and in a stable, long-term relationship. Without warning, everything crumbled. Everything. After taking a routine HIV test at a Legacy outreach event, Richard was devastated when his test results came back positive. He grew isolated and depressed. His relationship ended, and he relied more and more on food for comfort, to ease the anxiety, the loneliness. After ignoring follow-up calls from Legacy, he finally visited the clinic and slowly started regaining control of his life. Legacy understood that Richard's diagnosis and care went beyond the exam room. Every aspect of his life deserved attention and support. Legacy's Body Positive program focused on Richard's strength and conditioning needs, dietary habits, and psyche. The behavioral health team eased the stress of the diagnosis, and Next Step taught him to focus on living instead of his diagnosis. Through the care and support provided by his team at Legacy, Richard is confident about living a long, full life. Tanika was only 18, pregnant, and she was frightened. Life was hard, but the one thing she could count on was Legacy. The people made her feel comfortable. But life's burdens became too much. She began missing her checkups. Then at 7 months, her baby's movements decreased dramatically. Her concerns brought her back to Legacy, where an ultrasound detected some abnormalities. Legacy immediately referred Tanika to the ER. Her baby, Jasmine, was delivered by emergency C-section, saving the lives of both the baby and Tanika. But there were complications, and Jasmine was kept in the neonatal ICU for 2 months. Meanwhile, Legacy became a second home for Tanika. She enrolled in several Legacy programs, where she learned about infant care, nutrition, and breastfeeding. Now, Jasmine is nearly 1 and is a happy, healthy pediatric patient at Legacy. As she gets older, she will have access to Legacy's vision, behavioral health, and dental care. Today, mother and child are thriving, and their future is much brighter. Legacy. Driving healthy change in our communities. Won't you join us?